Welcome to this anatomy presentation. Today we're going to take the latest look at one of the most functional complex regions of the human body, the leg and foot. We will explore the bones, ligaments, muscles, nerves, arteries and veins, and we learn how all of these structures work together to make standing, walking, running, and balance possible. So let's begin our journey from the skeletal framework to the intricate neurovascular network. Let's start with the skeletal support. The leg contains two bones, tibia and fibula. The tibia, also known as the shin bone, is the primary weight-bearing bone. It forms the knee joint with the femur and the ankle joint with the talus. The fibula is much thinner and does not bear significant weight, but it plays a key role stabilizing the ankle and provide muscles attachment. Together, these bones form the structural base of the lower leg. Now, the foot is an incredible complex structure with 26 bones divided into three groups: tarsal bones, metatarsal bones, and phalanges. One tarsal bones, these include the calcaneus, the heel bone, the talus, the navicular, the cuboid, and three cuneiform bones. The calcaneus and talus form the rear foot and are essentials for transmitting body height from the leg to the ground. Metatarsals, five long bones that create the axial and the midfoot, they help distribute weight during movement. Phalanges, the toes arch. Thus, the phalanges is a big toe, which has two. These bones assist in balance and push off during walking. Altogether, this bony structure provides stability, flexibility, and shock absorption. Moving on to ligaments. Ligaments connect the bone to bone, are essential for joint stability. Ankle ligaments at the ankle will highlight two major groups: the lateral complex and the deltoid ligament or medial ligament. The lateral ligament complex, this includes the anterior talofibular ligament, the calcaneofibular ligament, and the posterior talofibular ligament. This ligament resists excessive inversion. The anterior talofibular ligament is actually the most commonly injured ligament in ankle sprains. The deltoid ligament or medial ligament, this strong triangular ligament prevents excessive eversion and helps stabilize the medial side of the ankle. Foot ligament. In the foot, the most important stabilizing structures include the long plantar ligament, the short plantar ligament, and the plantar fascia, also known as the plantar aponeurosis. The plantar fascia supports the longitudinal arch and plays crucial role in maintaining proper foot mechanics during walking. Now let's examine the muscle system. The legs muscles are grouped in anterior, lateral, and superior compartments, each specific function. Anterior compartment. These muscles dorsiflex the foot and extends the toes. Tibial anterior, the main dorsiflexor extensor, hallucis longus extends the big toe. Extensor digitorum longus extends the four lateral toes. They are essential for lifting the foot during walking to prevent dragging. Lateral complement. These muscles everett the foot fibularis longus y fibularis brevis. They help stabilize the ankle essential on uneven surface. Posterior compartment. The posterior compartment is divided in a superficial and deep groove. Superficial groove gastrocnemius soleus plantaris. These muscles form the arches tendon, the strongest tendon in the body. Forget they generate powerful plantar flexion essential for doing and jumping. Deep groove. This is tibialis posterior, flexor digitorum longus y flexor hallucis longus. These muscles help support the arch of the foot and enable to flexion. Extrinsic foot muscles. In addition to the long muscles that originate for the leg, the foot contains many intrinsic muscles. These smaller muscles control fine movements such as toe spreading, balance adjustment, and stabilizing the arch during gait. They ensure that each step is controlled and coordinated. Nerves. The nerves and the leg and foot originate in the sciatic nerve. The largest nerve in the human body is divided in two major branches. Tibial nerve. This nerve innervates the posterior compartment, is placed behind the medial malleus and divides in the medial and lateral plantar nerves, which supply most of the muscular skin on the sole of the foot. Fibular nerve. This nerve divides into the superficial fibular nerve, which innervates the lateral compartment and the skin on the dorsum of the foot. The deep fibular nerve, which supplies the anterior compartment and the skin between the big toe and second toe. These nerves allow movement and sensation from powerful calf contraction to the delicate movement of the toes. The blood supply with the popliteal artery is the popliteal artery, which divides in two main arteries: anterior tibial artery and posterior tibial artery. The anterior tibial artery travels to the front of the legs and continues onto the dorsum of the foot as the dorsal base artery and important pulse point. And posterior tibial artery. This artery supplies most of the posterior legs and enters the foot to divide in medial and lateral plantar arteries, which nourish the sole and foot. And efficient Artery supply is essential for the muscle function, healing, and maintaining healthy and tissues. Finally, let's look at the venous system. Superficial veins is the great saphenous vein and small saphenous veins. The great saphenous veins, the longest vein in the body, running medially up the leg. A small saphenous vein runs along the back of the leg. These veins accompany the arteries and include the anterolateral, posterior and the femoral veins. They really one-way valves and the muscle contraction to return blood to the heart. The leg foot form highly coordinated system of bone, ligaments, muscle, nerves, arteries, and veins. Together they create a strength for standing, elasticity for walking, and precision for balance and movement. Thank you for watching this delayed overweight. I hope the guide helps you better understand the incredible anatomy of the lower limb.